One a day works only if you do this first. Let's get started with our first health benefit of apple that works only if you do this first. If you have high blood pressure, are overweight or inactive, then eating an apple every day will not help you at all. But if you are looking to lose some weight, improve your blood sugar and overall health, then making apple your daily habit can make a huge difference. The reason why apple is so effective for weight loss is because it has a low glycemic index, meaning that it will not spike your blood sugar levels. Also, apples are very filling, which means that they can keep you full for longer periods of time. This can help you avoid snacking between meals or overeating at dinner. Eating an apple before a meal can also help to reduce the amount of calories that you consume during that meal. There is evidence that shows that people who ate an apple before a meal consumed less calories during that meal than those who did not eat an apple beforehand. However, there is one important thing that you need to do in order for apple to be effective for weight loss. You must crunch it. Studies show that people who crunch their apple consume fewer calories than those who do not. Crunching your apple will take more time to eat, which will help you feel full sooner. It will also help you to be more mindful while eating, which means that you will pay attention to your body's hunger and fullness cues. When you crunch an apple, it releases a pleasant, crisp sound that satisfies our brains. In fact, research has shown that the sound of crunching can decrease food intake by up to 30%. The act of crunching itself can also activate certain receptors in our mouths that send signals to the brain to reduce food consumption. Additionally, crunching an apple stimulates the release of saliva, which aids in digestion and helps control hunger hormones. Saliva contains enzymes and mucus that begin breaking down carbohydrates and fats, sending signals to the brain that you've already started digesting your meal. 2. One a day works only if you do this first. Don't eat apple if you have bad breath. Apple is good for your oral health, but if you have bad breath, it could make things worse. Apple has a crunchy texture that can help clean teeth by removing soft debris like food particles. And it does a pretty good job at combating bacteria that causes bad breath. However, when you have bad breath, your mouth is already full of bacteria. So when you eat apple, all that bacteria can end up in your stomach, where it can cause discomfort and bloating. In order for apple to be effective in removing bad breath, you must chew it thoroughly. Make sure to chew each bite of apple at least 20 times. This will help break down the apple and release its juices, which will stimulate saliva production and help neutralize any bad breath-causing odors. Also, make sure to visit your dentist regularly for checkups and professional teeth cleaning. 3. One a day works only if you do this first. Don't eat apple on an empty stomach. While apple is a healthy and nutritious fruit, it may not be the best choice to eat on an empty stomach. Apples are high in fiber, which is great for digestion, but it can cause stomach discomfort and bloating if consumed on an empty stomach. Fiber absorbs water as it passes through your digestive system, which can cause gas and bloating. And when you have an empty stomach, this process can be even more intense. In addition to fiber, apples contain acids that can stimulate gastric acid production in your stomach. This can worsen symptoms like heartburn and indigestion, especially if you're prone to these conditions. Therefore, it is best to eat apple after a meal or with some nuts or yogurt. Nuts and yogurt can help buffer the effects of apple acids and fiber, preventing any potential discomfort or bloating. 4. One a day works only if you do this first. Don't eat apple without seeds. Many people throw away the seeds when eating apple, but they shouldn't. Apple seeds contain a number of health benefits. They are a good source of fiber and healthy fats, which can help improve digestion and reduce inflammation in the body. Seeds also contain antioxidants that can help protect against cell damage and reduce the risk of chronic diseases. However, it's important not to eat too many seeds as they contain cyanide, which can be harmful to your health. So if you want to reap the benefits of apple seeds, you should crush them first. This will release the oil inside, which contains most of the antioxidants and nutrients. Then you can eat the crushed seeds along with the rest of the apple. Keep in mind that you don't want to grind them into a powder, as this will increase the surface area of the seeds and release more cyanide. 5. One a day works only if you do this first. Don't eat apple if you don't like it. If you don't enjoy the taste of apple, then there's no point in forcing yourself to eat it every day. Doing so will only make you feel miserable, and you'll eventually give up on your goal. Instead, choose a fruit that you like and that fits into your diet. There are many other fruits out there that are just as healthy and nutritious as apple, such as berries, bananas, and oranges. Berries are high in antioxidants, which can help protect against cell damage and reduce inflammation. Bananas are a good source of potassium, which can help regulate blood pressure. Oranges are rich in vitamin C, which can boost the immune system. Ultimately, the most important thing is that you find a fruit that you enjoy eating and can easily incorporate into your daily routine. 6. One a day works only if you do this first. Don't eat apple if you have gut issues. Apples are tough and fibrous, which makes them difficult to digest. For people with gut issues such as irritable bowel syndrome, Crohn's disease, or ulcerative colitis, eating an apple a day can cause discomfort and worsen symptoms. The high fiber content in apples can lead to bloating, constipation, or diarrhea. In addition, the acids in apples can irritate the digestive tract and exacerbate gut inflammation. Therefore, if you have gut issues, it's best to avoid apples altogether or consume them in moderation and only after consulting with your doctor. If you do decide to eat apple, it's important to cook them. Cooking apple makes them softer and easier to digest. Stewed or baked apples are a great option as they retain most of their nutrients when cooked. 7. One a day works only if you do this first. Don't eat apple every day. Eating the same food every day can lead to nutrient deficiencies and an increased risk of chronic diseases. Our bodies require a variety of nutrients to function properly, and eating the same food every day may not provide all the necessary vitamins and minerals. For example, apples are high in fiber and vitamin C, but they are not a good source of protein, iron, or calcium. Consuming the same food every day can also disrupt the balance of gut bacteria, leading to digestive issues and a weakened immune system. Additionally, eating the same food every day can lead to boredom and make it difficult to maintain a healthy diet over the long term. To ensure a balanced diet, it's important to eat a variety of different foods from all food groups. This can help meet all the nutritional needs of the body and reduce the risk of chronic diseases. 8. One a day works only if you do this first. Don't eat apple if you have braces. Apple is a very hard fruit, and its crunchy texture can be difficult for braces to chew. The chewing process can put excessive pressure on the brackets and wires, leading to discomfort and pain. In addition, the high sugar content in apple juice can contribute to tooth decay and increase the risk of cavities, which can be detrimental for those with braces. If you have braces, it's best to avoid eating apple whole or limit consumption. Instead, consider eating softer fruits that are easier to chew and less likely to cause damage to your braces. Some good options include bananas, avocados, and mangoes. These fruits are still nutritious and can help satisfy your sweet tooth without putting undue stress on your teeth and braces. 9. One a day works only if you do this first. Don't eat apple if you're taking medication. Apples interact with several medications, including diabetes drugs, blood thinners, and high blood pressure medications. Consuming apple juice or cider can increase the risk of bleeding in people taking blood thinners. It can also lower the effectiveness of diabetes drugs, leading to elevated blood sugar levels. In addition, the high potassium content in apples can interfere with medications used to treat high blood pressure, potentially leading to dangerously low blood pressure. If you're taking any medication, it's important to talk to your doctor about whether or not you can safely eat apple. Your doctor can advise you on the appropriate amount of apple to consume based on your individual circumstances and help you avoid any potential drug interactions. 10. One a day works only if you do this first. Don't eat apple if you're breastfeeding. Apple is a safe and healthy snack for most people, but there are a few things to keep in mind if you're breastfeeding. First, it's important to note that apple can cause allergic reactions in some babies. If your baby develops a rash or other signs of an allergy after consuming apple, then you'll need to stop feeding it to your baby and consult with your pediatrician. Additionally, the high sugar content in apple juice can be harmful to babies. Breastfed babies under 1 year of age should not consume any juice, including apple juice. If you're breastfeeding, it's best to eat apple whole so that your baby can digest the fiber and nutrients. Avoid giving your baby pureed or cooked apple, as it can be too soft and easier to choke on. Thank you for watching.